Hi, and welcome to the Bouncing Back podcast. I'm your host, Melissa McCurley. And if you haven't yet joined our Facebook community where we continue this conversation, check us out at Bouncing Back Professionals Thriving with Chronic Illness. I am incredibly excited to introduce our guest today, Monica McKitterick. She is a family nurse practitioner. She's the founder and CEO of Impact Family Wellness, which is a direct primary care practice, which I'm super excited to learn more about what that means. Welcome to the show, Monica.
Thank you so much, Melissa. I just realized we have the same initials. There's lots
We do.
of and some MC action going on. I feel like
Double
we're
M's, double
meant to be here.
MC's,
My middle
Scotch
name
Irish
actually
in the
starts with an
house.
M too. Yeah.
Also, for people who don't know what a direct primary care practice is, could you explain that?
Yes, and unfortunately, that's more people than I want it to be. It's actually my goal in life is to make sure everyone understands direct primary care and it's just well known. So direct primary care is a model of healthcare that is membership based, not insurance dependent. So we take patients with or without insurance. It's much like Netflix for your doctor or affordable concierge.
Okay.
Our patients pay $75 to $95 a month and they can come in as many times as they want. There's no copays, there's no office visit fee. It includes their annual physical lab work, all their telehealth visits. We do 70% of what we do via text message. So it also includes direct texting to your provider, not to a medical assistant, not to a nurse, to the person that makes the decisions. So we do about 70% of what we do via text message. There's a time and a place we need to touch you. But if you wake up and it hurts to pee, I don't really need you to come in the office. Likewise, if you have pink eye, do not come in. I can't look at you. I don't do eyeballs. I'll send you the medicine that will fix that. Don't get me wrong. There's a time and a place we need to touch a patient to develop a relationship and do all those things. But we just try to make healthcare convenient and affordable and price transparent and all the things. There's many more benefits, but that's the general gist is a relationship with a provider that's affordable and is like having a healthcare provider in your back pocket.
That is amazing. I'm not familiar with this model. So this is really encouraging. Yeah. Because for people living with chronic illness, a lot of times we have things that we need addressed or this and that, but getting in the car and like driving to the doctor and wait, that's like our spoons for the day. And it's so hard to balance life with that. And okay, so this is a new concept for me. And it's probably a new concept for most of my audience, I would think. Where did you come up with this? Did you discover it? How did you come to this? And what was that process for you?
I wish I could claim that. It's been around about 15 years.
Okay.
It is slowly growing because it's a significantly better situation for patients, but also for providers because provider burnout is a serious problem. And most of that is caused by paperwork from insurance companies. And so I found it via a Facebook ad that said primary care physician takes home $400,000 a year and is home in time for dinner. I was like, clickbait worked. Click.
You're like,
Yep,
and I'm
it.
signing up now.
Yeah. And so it was all about this model of care. And so I did a lot of research on it. And then I went to my husband who has an MBA. By the way, I have 0 degrees in business, marketing, any of it. I have 3 degrees in nursing. And I said, husband, I'm going to open a practice, which first was a joke. He thought it was a joke, where I can see less patients, take better care of them, have more control of my time, and make the same amount of money. He, of course, laughed in my face. I had to Google how to write a business plan, wrote a business plan, and actually relocated to a new state. And so I opened a practice where I didn't know anybody, and it was a new model. And so it was definitely a struggle, but the world of primary care is what I love. But unfortunately, in the insurance-based system, I was seeing 30 patients a day. I was treating them like cattle. I spent 70% of my time charting for an insurance company to convince them that they should pay the bill that I sent them. And it was exhausting. And I went into healthcare for relationships. I love to talk to people. I love to take care of people. I love to understand people. I love to have a good chit chat. What'd you do last weekend? Oh, okay, let's do this. And what I also found is that our healthcare system is very sick care based, not healthcare based. We wait for people to be dying or have terrible chronic illnesses when maybe we should have been talking about stress and sleep and nutrition and body movement, because those are the real pillars of health, let's be honest, not pharmaceuticals. And so I was just done treating my patients like cattle. And I wanted to do what I went to school to do. And that was to actually take care of patients. And so this gave me the gateway to do it. And it has continued to grow and amazingly. Yeah.
So this is music to my ears. Just everything you're saying is, I've not experienced this from the provider side. I have a couple of friends who are doctors, and I have heard and felt their frustration of what
Oh
some of the
yeah.
similar things you're saying. But how, like, what does a typical appointment look like with a patient? Like a new patient who does come in, how is that
Yeah.
different in this model?
All of our new patient appointments are 60 minutes long. They get their new patient paperwork to fill out. And then the first thing we want to know is who you are as a human. What do you do? Who are your kids? What are your stressors in life? Are you sleeping at night? Do you have dogs? Do you not have dogs? What do you like to do? And so getting to know a person is so important to making sure that they can make healthy choices. And we also want to know what type of healthcare you are interested in, right? If you are a person that wants a magic pill, okay, that changes the way that
Yeah.
we're going to have a conversation. If you're more holistic and you want to try things that aren't pills, then I'm going to document that and remember this. So that way, the next time I talk to you, Melissa, I'm not like, oh yeah, you need this pill. And you're like, actually, I don't like pills. And it's, oh, okay. And so meeting the patient where they are is so important in the healthcare world. But unfortunately, we don't have the time to do that. And excuse me, that first appointment is 60 minutes long. And then you can schedule another appointment the next day because our providers only see typically between 5 to 7 patients in a day. And so we always have same day appointments available. And we understand, especially as a new patient and we get a lot of new patients who haven't been seen by a healthcare provider in 10 years because it's been
Wow.
so hard. They didn't know who to see. And so it takes some time to see them and get them back under control and get some lab work done and all the things. It's really just a difference of approaching the patient as though the patient is the customer, which they are in this situation. But unfortunately, when you walk into an insurance-based system, you are not the customer. Your
Hmm.
health insurance plan is the customer. And so I, as the provider, have to do what the insurance company says I can do, not what you and I think is important. And that is a very different way of how you approach a patient.
That's really insane.
It is absolutely insane. Our healthcare system is so broken on so many ways. I could talk about this for hours.
We feel, why do we have 10 different conversations with 10 different doctors, all who are super competent and great in their field, but we can't seem to connect the dots
Right.
to the fact that, like, my postnasal drip and my skin rash and my psoriasis is all connected to, like,
Absolutely.
Hashimoto's, right? Like it, and it's not because that competence isn't there. It's like arrows missing the mark.
And it's because you talk to this specialist about this thing and this specialist about this thing, but they're actually all co-mingled. And part of that is that healthcare providers no longer have the time to talk to one another. It used to be that
Mm.
we could pick up the phone and be like, hey, cardiologist, I have Melissa here and she's telling me she's got these symptoms. Do you have any ideas on this? But they don't have time for that. Like reaching an actual healthcare provider is like the Wizard of Oz, right? They're behind a curtain in the back of the clinic. Nobody can get them. I even call clinics now as a provider. Like I push one because I'm a doctor's office and I still don't get people to respond to me. My husband is going through a knee issue right now. I called the surgeon's office yesterday morning at 8 a.m. and left a very detailed voicemail from his healthcare provider. I am a nurse practitioner. I did not say I was his wife. They did not call me back until 5:30 last night. It
Wow.
was only because I have the actual surgeon's phone number, which I was trying not to bother him. I was trying to go through the regular chains. Yeah, no, I finally texted him at 10:30 yesterday morning. He was like, oh, absolutely. I need to see him. When is he going to be back in town? And so he had an appointment at 10 o'clock this morning, but it's only because I had that phone number.
That's crazy. And
It's
it happens
ridiculous.
every hour of every day.
All day, every day.
It's the
When was the last
exception.
time you got a referral and they were like, here's your piece of paper? Do you know how much better it would be if your primary care provider could pick up the phone and be like, hey, rheumatologist, I have Melissa here. This is what's going on. I'd really like you to see her. He says, oh, great. Yeah, thanks. I'll see her. And then he sees you. Or he says, hey, before I see her, would you mind ordering an A, B, C, and D? So that way I have that when she comes in.
Right.
Absolutely. I'd be happy to do that because otherwise you're going to wait 6, 8, 12 weeks to see the rheumatologist. You're going to go see him. He'll be like, yeah, I need these labs. Go get this done. And then I'll call you back in 3 months, maybe?
That was exactly my experience. Yeah.
Exactly. And so
At the
if we could
rheumatologist.
just have a little bit of communication between provider to provider, but unfortunately there's so much bureaucracy and red tape put into place that healthcare providers are the only people that earn revenue in an office. And so they don't have time to talk to someone if they're not making money. And therefore that is why it's patient. And everyone else will try to do anything they can to get you not to take the time of the actual provider when that's exactly the person we need to be talking to.
Wow, that's amazing. I love it that you are a professional in this industry and you're changing it from the inside out. It sounds like the industry's kind of gotten hijacked by outside
Yeah.
forces of business and monetization and so forth, and you're doing this from the inside.
I'm trying every day. I just need more people to know it's an option.
Yeah, and I shared that mission because there's concierge doctors, and I think a lot of us are familiar with that, but that's so
Mhm.
inaccessible to most people.
It's
And
very
then there's,
expensive.
yeah, and then there's the general healthcare net. Interesting. How
Yeah. So
common
there is a
is
middleman.
how common is this model? Like I know you're in the Austin area. I'm in the
Yep.
Dallas Fort Worth, North Texas. Are there providers like this in all the sort of major
In
cities?
fact, there's about, last I checked, over 3,000 offices like mine across the country. Most of them are locally owned by the provider themselves, which makes a big difference because they aren't being told how to take care of patients by a CEO or a marketing guy or a finance guy. It's the actual provider making those rules. If you Google direct primary care mapper, it will take you to a map that has every direct primary care office across the country in it. And so you can find one near you. Most of these offices will offer a free meet and greet, a free 15 to 30-minute consult with the provider to make sure that they are a good fit for you. And this is the beauty of taking healthcare back to the free market. You, as the patient, get to choose who is your healthcare provider. Unfortunately, our insurance world doesn't allow that. You have to go
Right.
see whoever they decide is good enough for you on your insurance plan. But when it's direct primary care and you are choosing who, you get to find the person that fits your needs, right? Fits your personality, somebody that you get along with, as opposed to some guy you are assigned to. And so it's the best of both worlds for all the people. So yes, go find a direct primary care office. If you're in the Austin area, I promise we'll be the best. But yes, I actually have a dear friend in Burleson, Texas, who
I know
has a
Burleson.
direct primary care office. Her name's Rachel,
Really?
and she has an amazing office. It's called DPC Burleson.
Okay.
Pretty straightforward.
My
But yeah,
Burleson
they're
people,
great.
thank you. This is fantastic. I have so many questions for you. Honestly, it's hard for me to, they're all floating up here in my mind. I guess
Sure.
one question I have is could you share maybe an example, a particular story, or if there's some general commonalities of how this model works really well for the chronic illness
Hmm.
community? Because I feel like it absolutely would, but I'd love to hear your professional insight on that.
Absolutely. So, unfortunately, those with chronic illnesses oftentimes get referred out to multiple different specialists. And so, your primary care provider should be like the quarterback of your healthcare team. But oftentimes in the insurance world, they don't have time for that. And so, in the direct care space, we take care of a lot of autoimmuners, a lot of people who have symptoms that no one else wants to listen to or doesn't want to deal with because they don't fit a textbook. And so we're able to spend more time with patients and really figure out what's at the core of it. Because you're very right. Postnasal drip and rashes oftentimes go hand in hand, but most places will be like, oh, you need to go see the allergist and then you need to go see the dermatologist. And those things never cross. And so we don't realize that they are actually connected. And so by having someone who can actually sit down, have a full conversation with you that isn't rushed, that is more than 7 minutes, is really where our value comes into play. Because we see this all the time, especially now that perimenopause is becoming like a thing that people are talking about. It's huge, but especially for the chronic illness people. Now, there's a level where it's over our, at least our, so all of my providers are family nurse practitioners. And if you are a chronic med person, like you've got a list of 22 medications, you may be better served by an internist. So making sure that you find a direct care provider that is an internist might be a better situation for you. But that's one of the beauties of direct primary care is you have to find the provider that fits your needs, right? And so ask them straight up, be like, hey, I have Ehlers-Danlos syndrome. Do you know anything about that? And if they look at you like, I don't know what that is, then go find someone else. But especially when it comes down to the actual listening of people, because what happens with people of chronic disease is people start to, I don't know if judge is the right word, but they discount their symptoms because oftentimes they're like, oh, here she comes again. What's she going to complain about today? And it's no, they're complaining because they need help. And so when you actually have a relationship with somebody who's not questioning your validity, it can be very helpful.
Yeah, for sure. I know talking about the conversation in the one-on-one, I know one of the things that I have struggled with, particularly more in the beginning, was you start to do your own research, right? When you're not getting the conversations you want. And a lot of times on these online groups or Facebook groups, we do start to see, this person has these 4 weird symptoms, like inner ear stuff and vertigo and allergy, whatever, like you said. And we start to realize through these conversations there are commonalities, but it's frustrating when we don't get that insight from our healthcare providers. So that sometimes we don't know what to do. Do I go paleo? Do I go AIP? Do I go on a fast? Do I intermittent fast? Do I get off dairy and gluten? And it's like you can very easily get lost in all the possibilities. And so it's hard to know where to start. It's hard to know where to put your focus. If you don't track yourself really well when stuff works, it's hard to know what it was that you did that worked. I've heard a lot of people echo that it would be really nice to be able to walk that path with the healthcare provider, like you mentioned,
Absolutely.
as a quarterback.
Right. And what happens is oftentimes patients will come in with those lists. And that's the thing with especially dietary things. Like paleo is great for some people and vegan is great for other people and Whole30 is great and carnivore can be for some people, but everybody's body is different. But you're exactly right. Maybe we can narrow down what seems to be working and then go from there and really dive into, okay, when I eat black beans, it makes me feel terrible. Okay, then let's avoid legumes for a little while. Let's see how that goes. And just to have that person to walk through. I also think you're exactly right. Everyone does their own research now, which I love, but also we need to come to healthcare providers for advice still and not for demands. And I think that having that relationship with somebody as your trusted healthcare provider makes a big difference, where instead of being like, oh, ChatGPT says I should do fill in the blank,
Right.
bring it to them and be like, hey, so I saw this research. What do you think? And also I'm going to tell you, most healthcare providers are not trained in diets and supplements and nutrition, because guess what? That doesn't pay the bills in the insurance-based world. And so talking about sleep hygiene and how to deal with stress better, something like 80% of chronic illnesses are due to stress in this country. And it's maybe we should talk about that. But when was the last time your PCP asked you about your stress level? It's probably been a while. Yeah, I think it's especially important for those with chronic illnesses to have that trusted healthcare provider who will be an advocate for them and will fight for them and not just write them off. Oh, let me write this person some prescription to get them out the door and move to the next person.
For someone who has done some internet research, right, and has some things that they are curious about, maybe labs they think might be helpful to run, they've gathered some information. You're right. We don't want to come in as a know-it-all. Like, we spent 2 days on Granny Google, so we know everything. How,
Right.
on the receiving end of this kind of patient, what is a good way? Can you model a good way for us to bring that information to you and be constructive and make sure that it's communicated that we want to be on the same side of the table and respect your authority while also trying to verbalize our needs and experiences? And does that make sense?
Absolutely. We're going to role play. Ready?
Okay.
Hey, Melissa, it's great to see you again. So I haven't been feeling very well. And so I was doing some research and talking to some different online portals and looking in AI. And I think that I would like to get some lab work done, but I would love you to look through this list and tell me, based off of what you know, or maybe what you don't know, because maybe this is new, what would you suggest and what would you think might not be necessary? I would love your input on this idea. I think just asking them for their advice is really the key, because your healthcare provider went to school for 9, 12, 16 years and probably has 10-ish, like I have 17 years of experience. And so that should mean something. And so if somebody comes to me and says, hey, I have this idea, can you tell me what you think about this? First of all, I have to look at it and even know if I've ever heard of it, because there are so many new things in the world. I may have no clue what you just brought me. And so I have to, A, be able to look at it and be able to admit that I don't know what you're talking about, because you may actually know more about this situation right now than I do, because I've never heard of this new thing. So I also have to be able to admit that I don't know, but that I'm willing to research it and see what is next. But I will advise you, never say, I need this done. Say, I looked this up, and this is what I think maybe we should do. I would love your input on this. We'll get you much further with that healthcare provider than I need you to do this for me.
Makes sense. So curiosity and exploration versus making demands.
Absolutely. Especially when it comes to the world of lab tests, because there's a lot of lab tests out there that I can order, but I don't know what to do with the results because I've never been trained to do that. So if it's a lab test that a rheumatologist would order, I may not know what those results mean. And therefore, if I'm going to order that for you, I'm legally responsible for the results. And so making sure that we understand where we are. So I've told patients multiple times, listen, I can order this for you and I'll do some research on what the results mean, but I am not the best one to do this for you. And so as long as the patient understands that and we're just very clear and transparent, I think that's very helpful.
That makes a lot of sense. I actually just had that conversation with my general practitioner I see every year about a brain scan. I want to get some brain scan stuff done for the fog. And he's, look, I can order this. I can tell you the best place to get it. It's UT Southwestern, but I am not the person to interpret the results. And I had so much respect for him that he said that. Because we can't all be all things to all people about everything. And it's a real professional that says, hey, here's where my expertise ends, but let me find you someone. Yeah,
a tool that we use in my office a lot is we have a online consulting service. It's a software that we use that's free of charge for our patients. So if you came to me and said, hey, I want these brain scans done, and I got that brain scan back and it said words that I don't understand, I could send your report to a neurologist or a neurosurgeon or a rheumatologist, and they will get back to me quickly. Now, I also have some people I can pick up the phone and call, but it's really helpful, especially for those specialties that maybe I don't have that podiatrist in my back pocket that I can just pick up the phone and call. And so I think that's a really great tool that we use for our patients as well. And I know a lot of other DPC offices do use that as well to help save their patients time and money.
That makes sense. That makes sense. So if you make a referral, since you're out of insurance, if you make a referral to a podiatrist or to a rheumatologist, does that stay in network for the insurance, the specialist referral thing, do you find?
Yes. So yes and no. So if you have a PPO plan, I can refer you wherever you want to go. If you have Medicare, you have Medicaid, I can refer you wherever you go. That might change state to state. I think the state of Colorado has an issue with Medicaid issues, but
okay, so people would need to double check with your state laws. Yeah.
Yes. In Texas, if you have a PPO, I can refer you to a podiatrist that is in your network and it will be covered. Now, if you have an HMO, that means you have some primary care provider's name written on your insurance card. Okay. Then the referral has to come from that person. And so that is where we do run into a brick wall with direct primary care, is that if you need a referral somewhere, and that can be for an MRI, a mammogram, lab work, they'll let us slide. But HMO plans are the absolute worst thing ever created in the world of insurance. So my first piece of advice is get a different insurance plan, because HMOs are so restrictive and absolutely ridiculous. But if you have an HMO plan, that is an issue you may run into in the direct care world. But if you have a PPO, no problem.
That's amazing. Thank you for that bit of information. I know when I was trying to look at different healthcare plans and compare this to this, it was like Greek. I have no idea. So the HMO is very limiting. You have that flexibility. Okay. That's great to know. Absolutely. Thank you. Yeah. We're about to run up on time. Oh, go ahead.
As of January of 2026, you can use your HSA to pay for your direct primary care membership.
Oh, I didn't even think to ask the question. That's a great question. For people in the audience who don't know what an HSA is, do you want to explain?
Yeah, so an HSA is a health savings account. It is money that you can pull out of your paycheck pre-tax that can be used for medical expenses. They can actually be invested now, so you can actually keep money in there and it will grow. So it's not just a lowly savings account anymore. So especially if you have a high deductible plan through your employer, oftentimes there will be an HSA account attached to it. And so it's a great way to pay for your healthcare pre-tax on your income.
Yeah. Awesome. And like you said, this is something to talk to an accountant about, but you can also make investments. I even had a client who funded my fix and flips with his HSA, and then the money he made on the interest, he was able to roll back into that. And his wife got like plastic surgery. I don't know. It was a pretty sweet deal.
It's pretty great.
Yeah. Awesome. This is amazing. Thank you so much. Tell me, where can people find you?
Yeah, so my office is Impact Family Wellness, and we're that on all the socials. That's our website name. So if you're interested to know more about direct primary care, there's a lot of FAQ videos. My face is all over those social channels explaining what we do, all sorts of education. I also educate other healthcare providers who might be interested in pursuing the direct care space. So I have a company called DPC Formula. So it's dpcformula.com. And I have a book and an online course for those considering the DPC space. I just need all the best providers to start a DPC office so that everybody can have a DPC provider.
Awesome. And so your course and your book are for healthcare providers, right?
They are. The book is more the should you? Are you the right person to start this practice? And then the
Okay.
online course is the yes, I want to do this to launch. So how to establish an LLC, how to get a brand, websites, all that stuff.
And where can people find the book?
It's on Amazon, but you can
Okay.
also, there's a link on my website, dpcformula.com.
Okay. Awesome. Any last parting words or parting story or?
I just want the world to know what direct primary care is. So if you're listening to this and you've never heard of it and now you're enlightened and you know all the stuff, go tell somebody else about it, because the world just needs to know that there is an alternative to crappy healthcare. We don't have to deal with this ridiculous system that is all we have access to here in the States. There is an alternative that's affordable and fit for you. So share the word, my friends.
Amazing. And I'm so excited about this. This has lit me up. Thank you. I'm a
Absolutely.
big researcher too. I pride myself in that. And I had not come across this. So this is a very big stone unturned. Thank you.
Yeah, you're not alone, my friend. Give me 10 years and everybody will know what it is.
And everybody will know your mission. Thank you
Right?
so much for tuning into the Bouncing Back podcast. We'll be back in 2 more weeks with more stories, strategies, and tools for success. And so until then, keep bouncing back. Thank you, Monica, and have an amazing rest of your week. Thank you so much for joining me on this episode of the Bouncing Back podcast, Professionals Thriving with Chronic Illness. I hope you found inspiration and actionable takeaways to support you on your journey. If you enjoyed this episode, please subscribe, leave a review, and share it with someone who might need a little encouragement today. Remember, thriving with chronic illness is possible. You are stronger than you think. Until next time, take care and keep bouncing back.